Hello, I'm Marian Mulkey, Director of the California Healthcare Foundation's Health Reform and Public Programs Initiative. Our foundation works as a catalyst to fulfill the promise of better healthcare for all Californians by supporting ideas and innovations that improve quality, increase efficiency, and lower the costs of care. Big changes are coming in the way Americans get and pay for their health care. By 2014, the National Health Reform Law, known as the Patient Protection and Affordable Care Act, could help as many as 32 million Americans who now have no health care to receive coverage, and it will transform the way many others are covered. One of the central ways this will happen is through the creation of state health insurance exchanges. The law requires that each state establish an online exchange to help consumers comparison shop for affordable policies. Each state is allowed to build its own exchange, but if they don't, the federal government will provide a fallback option. California was one of the first states to create an exchange after the passage of health reform. The exchanges will play a central role in determining people's eligibility for public programs, such as Medi-Cal, and in qualifying people for subsidies to buy private health coverage. However, those who don't qualify for federal subsidies may also get coverage through the exchange. Those who are not living legally in the United States are neither eligible for subsidies nor coverage through the exchange. The health reform law is clear. Buying coverage through the exchange is the only way consumers and small businesses will be able to obtain new subsidies intended to help people afford coverage. That said, the exchange is not the only way insurance carriers can sell to individuals and small groups. Unsubsidized coverage will remain available outside the exchange, although it remains to be seen how many people will participate inside and outside. The exchange will group health insurance options by how comprehensive they are. Plans will range from those that cover 90% of the expenses of an average population, dubbed Platinum, to those covering 60% of those costs, dubbed Bronze. A lower catastrophic level will also be available primarily to those under age 30, should they select it. This system should help consumers compare health plans and figure out the best coverage for them. In 2010, California established its own version of the exchange. California law states that its exchange will engage in something known as selective contracting. This means the exchange's board will choose which plans to make available through the exchange. The law requires that selection criteria be applied consistently and uniformly in order to provide, quote, the optimal combination of choice, value, quality, and service. The California law also allows the exchange to standardize benefits. If the exchange exercises that option, each insurance carrier that sells coverage through the exchange will have to sell some policies that are exactly like the policies of other companies to make it easy for consumers to compare. You can access more information about the Foundation's work in support of the implementation of health reform at chcf.org/health reform. I'm Marian Mulkey from the California Healthcare Foundation. Thanks for watching.